You know, when you walk into a hospital these days, the tech is just incredible, almost sci-fi.
Definitely.
But it's really the people behind that tech, the skilled operators who make it all work for diagnosis.
Absolutely. They're the crucial link.
So today we're doing a deep dive into some key roles in medical imaging using these job descriptions you sent over.
Yeah, focusing on a few specific technologist positions.
And these jobs seem to be mainly in Vaughan and Richmond Hill, Ontario. The descriptions often mention a state-of-the-art smart hospital.
Right, which gives you a sense of the environment. High-tech, probably quite advanced.
Sounds like it.
And it's worth framing these roles.
Yeah.
You know, they're providing that critical visual information doctors need.
Right. For diagnosis, treatment planning.
Exactly. They're not just button pushers. They are a really vital part of that whole interprofessional team, interacting with patients, making sure the tech serves the person.
Okay, good point. So our plan is to look at 3 roles: MRI technologist, CT technologist, and ultrasonographer. We'll break down what they do, what you need to get the job, and what makes these particular opportunities stand out, based only on the info in these descriptions. Ready to unpack this?
Let's do it.
Okay, first up, registered technologist MRI. Location is Vaughan, permanent part-time medical imaging department.
Right. So the core function, as you expect, is operating and maintaining the MRI scanner, getting those diagnostic images.
Pretty straightforward.
Well, yes and no. The description really stresses working closely with the radiologists.
Ah, the doctors interpreting the scans.
Exactly. So that implies a need for real technical skill in optimizing image quality. You're not just running a standard protocol. You're adjusting things, thinking about the physics to get the best possible picture.
Okay, so it's quite dynamic. The sources also talk about contributing to safe, quality care.
Yeah.
What does that involve day to day for an MRI tech?
It means juggling workload, probably in a pretty fast-paced setting. It's a hospital, after all.
Sure.
And resolving issues respectfully. Could be technical hiccups, could be helping a nervous patient through the scan.
Yeah, MRIs can be tough for patients.
Definitely.
Yeah.
It also means using solid professional judgment. Following best practices, especially crucial around MRI safety, you know, the magnetic field.
Right, no metal.
Exactly. And fostering a safe, inclusive environment is mentioned too, which points to the importance of teamwork and patient interaction.
Okay, so if someone's listening and thinking, I want that MRI job, what are the absolute must-haves according to these descriptions?
Okay, the non-negotiables listed are a diploma or degree in radiography from an accredited place.
Standard.
Yep. Membership in good standing with the College of Medical Radiation Technologists of Ontario, the CMRTO. That's key.
CMRTO, got it.
And proven clinical experience focusing on patient care. They break that down. Patient assessment, care planning, patient education, which is vital for MRI, and good documentation.
So the patient care aspect is really baked in, not just the soft skills?
It seems very integrated, yeah. Less about just the tech, more about the whole patient journey through the scan.
Makes sense. What about the nice-to-haves or other things they expect you to bring?
Well, experience with EMR electronic medical records is mentioned. Pretty standard these days. Knowledge of relevant Ontario laws, the Regulated Health Professions Act, Occupational Health and Safety Act, WHMIS, and, interestingly, the standards of practice from the College of Nurses.
Nurses? Why that?
Good question. It probably points towards needing to understand the broader context of care and collaborating effectively within the whole hospital team.
Okay, interesting. And the soft skills, these seem huge in all the descriptions.
Oh, definitely. For MRI, excellent communication is top of the list. Interpersonal, listening, verbal, written, all in English. Makes sense. Dealing with patients and colleagues.
Sure.
Strong decision-making, problem-solving, critical thinking things can change quickly during a scan, right?
Yeah, you need to adapt.
Exactly. Initiative, adaptability, commitment to ongoing learning, proven attendance, ability to do the job physically, standard stuff.
But then there's that phrase.
Right. Effectively uses empathy. That really stands out. It's repeated across the roles.
It is. And aligning with the hospital's values, excellence, leadership, empathy.
It suggests they're really looking for that compassionate approach, not just technical skill. It's part of the job performance.
Effectively uses empathy. It implies action, not just feeling. Powerful. Okay, what about preferences? What gives you an edge for this MRI role?
Preferably membership in CareMRT or OMRT. Those are professional associations.
Okay.
Minimum 3 years of hospital MRI experience is preferred. So they value experience.
Makes sense.
And specifically experience with both 1.5 Tesla and 3 Tesla MRI systems.
Okay, 1.5T, 3T. Why does experience with both matter? What's the difference for the tech?
Right, so T stands for Tesla, the unit of magnetic field strength. 3T is, well, twice as strong as 1.5T.
Okay. Stronger magnet, better picture.
Generally, yes. 3T can give better resolution or faster scans for certain things like brain or joint imaging, but it's also trickier.
How so?
More potential for image artifacts, different safety considerations because the field is stronger. Some imaging sequences just behave differently. So knowing how to handle both, how to optimize on both platforms, shows versatility and a deeper technical grasp.
Ah, okay. So it's about mastering different tools for different jobs, essentially.
Yeah.
Got it. Anything else preferred?
Yes. Ability to speak a second language is a plus, reflecting the community and previous experience specifically as a registered technologist.
Okay, really thorough look at MRI. High tech, high touch, lots of safety focus. Let's switch now to the registered technologist CT. Locations listed are Vaughan and Richmond Hill, permanent full-time, reporting to the medical imaging manager.
Right.
Now, this is where one description got really specific and quite exciting, actually.
You mean the funded certification?
Yes. They're offering to pay for CT certification. Tell us about that.
Yeah, this is the big deal. The source material makes it clear this is targeted at registered techs already working in, say, X-ray, IR, or mammography who want to move into CT.
So an internal growth opportunity.
Exactly. The hospital, that state-of-the-art smart hospital, covers the full cost. Tuition, books, materials for the computed tomography imaging certificate with CMRT, the Canadian Association of Medical Radiation Technologists.
That's amazing support. But there's more, wasn't there, about salary?
Yes, and this is key. While you're doing the course, you stay on your current salary and keep your benefits.
Wow. So you don't lose income while retraining?
Correct. And once you successfully finish the course and pass the exam, you continue working there. But now as a CT technologist, it's a really smooth, fully supported transition.
That is a fantastic offer, a real investment in their people. So, okay, once you are a CT tech, what are the main responsibilities according to the sources?
Pretty similar in structure to MRI, but focused on CT, obviously. Performing and coordinating the CT scans, ensuring high-quality images.
Using X-rays this time, not magnets.
Yeah, right. And that means a huge emphasis on operating the scanners and equipment safely, specifically radiation safety. That's paramount in CT.
Makes sense. What does that radiation safety piece look like practically?
It's constant vigilance. Understanding dose protocols, how much radiation for this patient size, for this type of scan. Using shielding correctly. Optimizing the scanner settings to get the diagnostic info needed with the absolute lowest radiation dose possible. The 𝗨𝗯 principle, as low as reasonably achievable.
𝗨𝗯, right. Requires real technical understanding.
Deep understanding, yeah. And like the MRI role, it involves managing workload, using professional judgment, following best practices, and keeping the environment safe and inclusive.
And the must-have qualifications for CT? Similar baseline to MRI.
Very similar foundational requirements because it's also a registered technologist role. You need the radiography diploma degree. You need that CMRTO registration in good standing, strong patient care skills, assessment, planning, documentation, EMR experience, knowledge of RHPA, OHSA, WHMIS.
Okay.
And again, those core skills. Excellent communication, decision-making, problem-solving, commitment to learning. It really shows a consistent standard for technologists.
What about preferred qualifications for CT?
Postgrad education specifically in CT is preferred, although the funded program covers that if you take that route.
Right.
KMRT or OAMRT membership again. Ability to speak a second language. And previous experience as a registered technologist. Very similar preferences to the MRI role, actually.
And did the sources mention why someone should take this CT job? Any why join us points?
Yeah, they did. It basically summarized the big perks. The career development through the funded certification, competitive salary and benefits package, working in that state-of-the-art facility and being part of a supportive team. It really sells the opportunity well, especially that training pathway.
Okay, that's 2 roles covered. MRI with its focus on magnetism and patient interaction, CT with the radiation safety and that amazing training offer. Let's move to our 3rd role, the ultrasonographer.
Sonographer.
Right. Locations again in Vaughan and Richmond Hill. Status listed as permanent part-time and just part-time. Still medical imaging. And the shifts look varied: on-call, days, evenings, nights, weekends. Needs flexibility.
Yeah, ultrasound is often needed around the clock. The core job here is different again, using high-frequency sound waves to create images.
So no radiation, no giant magnets?
Correct. The main task is producing high-quality diagnostic ultrasound images of specific body parts, following set protocols. It's crucial diagnostic support. But ultrasound is Well, it's very operator dependent.
Operator dependent. What do you mean by that? How's it different?
It means the quality of the scan, the images you get, relies incredibly heavily on the skill of the person doing the scan in real time. You're physically moving the transducer probe over the patient, constantly adjusting the machine settings, depth, focus, gain, while interpreting the anatomy as it appears on the screen based on sound wave echoes.
So it's less automated, more hands-on interpretation during the scan itself.
Very much so. It demands excellent hand-eye coordination, understanding of cross-sectional anatomy, spatial reasoning, and the ability to really adapt your technique on the fly depending on what you see or the patient's body type. It's quite interactive.
It sounds like it requires a real blend of technical skill and anatomical knowledge. What are the must-haves to be an ultrasonographer, according to these sources?
Okay. You need a diploma from an accredited ultrasound program that's a separate training path from radiography.
Different diploma. Got it.
You still need to be registered and in good standing with the CMRTO.
Okay, CMRTO again.
But, and this is a key distinction for ultrasound, you also need active membership with the Canadian Association of Registered Diagnostic Ultrasound Professionals, 𝗨𝗃𝗄𝗆.
𝗨𝗃𝗄𝗆. Okay, so 2 registrations needed, CMRTO and 𝗨𝗃𝗆.
Exactly. That 𝗨𝗃𝗆 credential specifically validates competency in diagnostic ultrasound practice in Ontario.
Interesting distinction. What else do they need to bring?
The ability to work well in a team, but also independently, because you're often scanning solo.
Right.
Excellence in communication, written and oral, again, proven attendance, understanding and complying with safety policies, different risks maybe, but patient handling, ergonomics, infection control are still key. Ability to perform the essential duties. And there it is again. Effectively uses empathy.
That phrase really does stand out across all 3.
It does, along with demonstrating behaviors consistent with the hospital's values. Excellence, leadership, empathy, and a commitment to providing an exceptional experience. It's a consistent message.
What about preferred qualifications for the ultrasonographer?
Preferably, active membership in other professional bodies like CSDMS or OSDMS. A minimum of 1 year of current related hospital experience is preferred.
Current experience, okay.
And specific experience in different ultrasound areas is a big plus. OBGYN, abdominal, small parts, vascular, shows breadth. And, like the others, previous experience in the ultrasonographer role itself.
So knowing your way around different types of ultrasound scans, babies, organs, blood vessels is highly valued.
Absolutely. Ultrasound is used all over the body, so being proficient across those main areas makes you a very valuable team member.
Okay, so stepping back now, looking at all 3 roles, MRI, CT, ultrasound, based on these descriptions, what are the big common themes?
Well, it's fascinating, isn't it? You see this blend of really sophisticated technology operation with deeply human skills.
Definitely.
All roles are critical for diagnosis. All require specific accredited education and registration. CMRTO is the common thread for the registered techs, with 𝗨𝗃𝗄𝗆, unique to ultrasound.
Right.
Huge emphasis on safety, tailored to the modality, magnetic field, radiation, or just general patient safety and ergonomics. Communication, critical thinking, problem solving are universally essential. And that constant drumbeat of effectively using empathy and aligning with hospital values, excellence, leadership, empathy, that really ties them together. Plus, a commitment to continuous learning.
It's striking how consistent those core human elements are, even when the tech is so different. Magnets versus X-rays versus sound waves. And you mentioned all descriptions had a diversity and inclusion statement, too.
Yes, standard EEO statement, commitment to an inclusive environment, offering accommodations. It frames the workplace culture they aim for.
So ultimately, these roles need people who can master complex machines and connect with patients compassionately.
Precisely. You need the technical chops to understand physics and protocols, and the human skills to manage anxiety, explain procedures clearly, and just care, especially when patients are feeling vulnerable.
So what does this all mean for you listening? Well, it means there are some really compelling, high-impact careers in medical imaging, especially in that Vaughan and Richmond Hill area. Whether you're just starting, looking to specialize in MRI or ultrasound, or maybe you're an X-ray tech thinking about that amazing funded CT pathway, these roles offer a chance to work with cutting-edge tech and make a real difference in patient care.
And it brings up a really interesting question for the future. You know, as imaging tech gets smarter, maybe with more AI involved in analysis, how does that role of these skilled human technologists, the one providing that essential human touch and on-the-spot judgment, continue to evolve? How does it remain indispensable?
That's a great provocative thought to leave people with. The balance between tech and touch. Now, if someone was listening and is interested in these specific roles.
Yes, for anyone wanting to learn more or explore these opportunities.
Want to learn more? Contact Doreen Silva at doreen.silva@wilsonhr.com.
That's doreen.silva@wilsonhr.com.com.